So something else that I actually do is I do work with people that do craniosacral for headaches. Is very, very important. With that said, now I'm going to continue the work I started supine. And I'm going to focus on the posterior cervical muscles. The suboccipitals refer pain as a headache ghost. The idea of the trapezius I'm going to focus more when she goes face down. But yes, I'm touching a little bit of the trapezius. Splenius captus goes to the top of the head. Splenius cervicis is one of the most overlooked muscles in stiff neck. We're going to talk about in the other class. And the idea, my friends, of splenius cervicis at C4 level goes behind the eye, poke behind the eye. I'm going to start at the cervicals with my hands together here. You guys saw some of that work already, so I'm just, and again, anything I do, please let me know. I'm going over the mastoid process with my hands side by side. They never go flat, always into that captain hook, and addressing it gently, back and forth here. Oof. Right here I feel some of her tenderness that she complains about where she places the eyes. So right now I'm doing corn on the cob all through the occiput and the temporal bone, right at the suture. The mastoid is right here. How is that? How does that feel? The head is interesting, the skull. Certain area, because the skull is hard, right, because the bone. But the skin, the gallia aponeurotica, and right here we have a muscle known as occipitalis, which is above the occipital protuberance. And the occipitalis talks to the top of the head and talks to the frontal bone. So I have to corn on the cob, meaning every single millimeter of her skull is being talked to right now. And that's something I don't think she has done in detail like that. Right?
Correct.
It feels really good, doesn't it?
Yeah, it does.
Yeah, because the gallia aponeurotica is just, if we imagine fascia. If this is tight, then obviously the toe gonna go tight. Right here. Woo! But back here is more. Now, suboccipital. So I'm doing a combination of my thumb and my middle finger and my index finger. Okay, to create a lot of surface, because here, this is tender for her. So I'm going to be very, very careful. And I'm going towards the occiput and the laminar groove of the atlanto-occipital joint does not, the laminar groove almost doesn't exist, you guys, because it doesn't have a spinous process and doesn't have a body. It has a wannabe spinous, it's a turbicle. And has the longest transverse. See, it comes right here. That's part of C1. You're feeling right here. Mm-hmm. And that is very tender, and people often, atlanto-occipital joint, the C1 is the 1-year-old. Yes. Yeah, now I know why the chiropractor is talking about C5. Oh, makes sense. Oh, I like your chiropractor. It will be good for us to talk so we can collaborate for you. Oh. See, here is more towards C5, huh?
Yes.
You feel the tenderness.
I do.
And then here is more towards C. Ooh.
I've never heard of C. Ooh.
C2, C3. Ooh. No, that's correct. You never heard the ooh. My mind went to the ooh because of right here. Feel it. There are adhesion there.
Oh, I do. I feel it.
It feels like how interesting that when you were a teenager, you think you didn't do any whiplash, which is normal. I also don't think I did whiplash, but I did left and right. Ooh, okay, but feels good, feels healthy. It's just a little confused. I am, wrist is relaxed. Now, petit detail.
Yeah.
When I use my elbow, I do use my elbow, but because the skull is hard and this is hard, I don't want to feel like bone on bone. Right. So you're going to see me going back and forth gently. I'm searching for your sensations that you experience when you're not with me.
Okay.
So let me know, okay? And again, in a good way. I don't want to mimic the headache. I want to, it's going to mimic, and that's the point I want to stay.
Perfect. Sounds good.
We are going to get it. We are going to get it. Oh, I love a little challenge, don't you? Mm-hmm. No, this two is too low. This two is too low. Okay, I'm going to go. This side here doesn't feel proper. It doesn't feel like I'm doing the work. I'm going to change positions, constant. You let me know, okay?
Yep.
Okay, yeah, that's already better, isn't it? Do you notice?
Yes.
Yeah, I immediately notice.
All right there.
Yeah, and that's the most.